For our International Field Study Experience project sponsored by Julian Thompson, our group will be analyzing the impact of social media on public health throughout the continent of Africa. The African continent is the world's second largest and second most populous, which has led to great diversity and rapid progress and development in the region, especially in recent years. Technology has played a huge role in this development, as mobile technologies alone have generated roughly 1.7 million jobs and have contributed $144 billion to the continent's economy, or roughly 8.5% of their total yearly GDP. African technology has been updated to respond to recent crises as well, such as the COVID-19 pandemic. According to a study done by the World Health Organization, 13% of all new or modified technology developed to respond to COVID-19 is African. As we begin to explore the continent of Africa and their uses of modern technology in the form of social media in order to influence public health, we will analyze the successes and failures, along with trends and common issues throughout the African continent. First, there are a few important and shared factors amongst many countries in Africa that affect their use of social media and its impacts there. The populations of African countries are generally very young, and as shown in the graph to the bottom right by the Pew Research Center, younger generations are much more likely to utilize the internet in Africa, which provides us with a better idea of the population that is present online. Studies have also shown that Africans have little trust in their press, which can lead us to assume that many may use social media as a primary news source, which is important to note as we consider the level of trust online and fake news consumption. African countries are also undergoing rapid change in many ways, not only through economic development, but through politically volatile situations as well, as we have seen many civil conflicts throughout the continent in recent years. Though we will dive deeper into prominent social media platforms within the specific countries in this region, it is worth noting that Facebook is by far the most commonly used social media throughout Africa, following closely behind are Instagram, LinkedIn, Twitter, and WhatsApp, along with the rapidly popularizing TikTok. First, we'll start by looking into North Africa. We've decided to focus on Egypt specifically, given their majority Muslim population, which is different from many other countries in different regions of Africa. Now, for an overview of the Egyptian population and the country's public health system. Egypt is the third most densely populated country on the African continent, with approximately 105 million people residing there currently. As we mentioned, the vast majority, or about 90%, of Egyptian citizens identify themselves as Muslim. Egypt also has a very young population. 52% of all Egyptians are under the age of 25, while only 6% are over 65. Moving into the health sector, Egypt offers both public and private healthcare systems. Private is more sought after due to the higher level of care, but can be difficult for many to attain financially due to inadequate health insurance. Egypt faces many health-related challenges, including low standard of care and hospitals that are not updated, corruption and lack of accountability in the country's Ministry of Health, and an unreliable hospital system overall, sometimes even in private facilities. Another aspect of health in Egypt that is worth mentioning is mental health. There is an overall lack of awareness for mental health challenges in the country due to social stigma. Treatment costs for mental health issues are also exorbitant in Egypt. Moving back to our last point on the left, there is hope for the future, as Egypt's relatively new constitution, adopted in 2014, aims to continuously improve healthcare and access to it for all Egyptians. Next, we'll take a look at some trends in social media use in Egypt. 75.6 million people, or approximately 3/4 of the total population, had access to internet use in 2022. 94.5% of those internet users also own a smartphone, giving them easy access to social media platforms in their pocket. 49% of the total Egyptian population actively uses social media. Facebook is by far the most popular platform, with its subsidiary Facebook Messenger and other sites such as WhatsApp, Instagram, and TikTok following closely behind. One interesting thing about social media in Egypt is that it is relatively gendered when compared to other countries. It has been calculated that women only represent about 38 to 46% of the social media presence, while they represent half, 49.5% to be exact, of Egyptian population. At the start of 2022, 36.5% of Facebook's ad audience in Egypt was female, while 63.5% was male. Social media has been a force for political change and a valuable tool for social revolution in Egypt. This has made the government, citizens, and social media companies alike harness its power to influence aspects of mental and public health recently as well. One obstacle for complete saturation of the population in this change is internet access. which still remains limited for those living in more remote areas. Now, let's look into some of the public health-focused social media campaigns in Egypt. First, we've got HarassMap. HarassMap is a tool created by activists that allows women to report instances of sexual harassment using Google Maps. It helps other users to know areas to avoid and provides victims with options for support services. Next, the 100 Million Healthy Lives campaign, which was started by Egypt's president following a loan from the World Bank. This program is focused on providing free medical screenings and treatment to Egyptian citizens and the thousands of migrants and refugees living in the country alike. One of the main goals of this campaign was hepatitis C elimination, which was rampant in Egypt at the time of the program's conception. They were quite successful in doing so, and the World Health Organization has commended the Egyptian government's efforts and commitment to ease and accessibility of healthcare. The COVID-19 pandemic was also a pivotal moment for analyzing the effects of social media in Egypt. Social media use, during quarantine especially, played a major role in the spread of fear and panic about the virus. Simultaneously, citizens also used social media to hold their government accountable, as they had not been completely honest about the levels of COVID-19 in the country. This pressure forced them to be more upfront about numbers throughout the rest of the pandemic. The Arab Spring in 2010 sparked an era of social media revolution, during which platforms like Facebook and Twitter became a space for citizens of the region to air their grievances, plan protests, and provoke change. Governments such as that of Egypt that were weakened during this time period were not a fan of this behavior, however, and Egyptian social media users have seen the effects of this government control since. Egypt passed a new media law around 2018 that allows the Supreme Council for the Administration of the Media, Egypt's media regulator, to supervise popular accounts on Facebook, Twitter, and other platforms. Egypt's Supreme Council was also given the power to block websites and file criminal complaints against platforms and individuals that were accused of offenses such as inciting people to violate laws and defamation against individuals and religions. Social media accounts and blogs with more than 5,000 followers in Egypt on sites such as Twitter and Facebook will be treated as media outlets. This makes them subject to Egyptian law for prosecution for publishing false news or incitement to break the law. Laws passed in 2015 make it a crime to publish or promote any news about terrorist incidents in Egypt that contradicts official statements. The Egyptian government has also blocked hundreds of websites since 2017, including those of various news outlets, NGOs, and human rights groups. This has been demonstrated recently through the treatment of various women Egyptian influencers. Egyptian authorities have since 2020 carried out a campaign to silence female social media influencers. They've used a cybercrime law to detain them on vague charges such as violating public morals and undermining family values because of their social media posts. This sets a dangerous precedent against freedom of speech and oppression, and also becomes a women's rights issue as well, because instead of focusing on the pervasive domestic violence, sexual harassment, and overall violence towards women in Egypt, the authorities are instead focusing on persecuting women and girls for how they appear online, and thus reinforcing societal discrimination.
Moving into 2020, Eastern Africa marked itself as the most densely populated region in Africa, boasting about 445 million residents. Within this vast expanse, social media usage revealed a male dominance with 59% men compared to 41% women as of January 2022. For a more comprehensive exploration of social media utilization in this region, we'll focus our lens on two nations in particular, Kenya and Ethiopia. Kenya is celebrated for its rich demographic diversity. The population leans heavily towards a youthful demographic, with approximately 60% being under 25. Over 40 distinct ethnic groups populate the country, with the Kikuyu, Luo, and Luo emerging as the largest. Gender distribution nearly mirrors each other, with marginally higher male population. Ethiopia mirrors Kenya in its ethnic diversity, hosting groups like the Oromo, Amhara, Somali, and Tigray. The population skews young, similarly to Kenya, with a median age of about 19. Gender distribution closely follows that of Kenya, maintaining a near parity. Religion leaves a profound imprint on both societies. In Kenya, Christianity prevails, practiced by about 85% of the population, with Islam trending around at 10%. Similarly, Ethiopia leans heavily on Christianity, with the Ethiopian Orthodox Church being the predominant denomination. Islam also enjoys a substantial following in Ethiopia. As of 2023, Kenya and Ethiopia have a population of approximately 55 million and 126 million respectively. Healthcare in Kenya is a blend of government and private entities, but access remains a hurdle for many, especially in rural communities. Diseases such as HIV, AIDS, malaria, tuberculosis pose a significant challenge to Kenya's public health. Likewise, Ethiopia grapples with a similar healthcare challenge confronting infectious disease, malnutrition, maternal and child health issues. With healthcare primarily provided by the public sector, access remains a barrier, particularly in rural regions. The country also reveals a substantial gap in mental health services. Technological growth, particularly in internet and mobile usage, has surged in Kenya. As of January 2023, around 32% of the Kenyan population access the internet, with about 10 million users engaging with social media, accounting for 19.3% of the population. On average, Kenyans spend about 3 hours and 34 minutes daily on social media, with the majority of users being male. Mobile connectivity flourishes in Kenya largely due to the revolutionary mobile money service M-Pesa, which was launched in 2007 and had over 52.5 million users across Africa as of 2022. To illustrate the growing significance of social media in health initiatives, we've identified 4 prominent health-related campaigns in Kenya. The Ushahidi platform, an open source software, facilitates data collection and visualization. First deployed during Kenya's post-election violence in 2008, it's since been utilized in various crisis scenarios, including health emergencies. The Kick Out 19 COVID campaign, launched by the Kenya Red Cross Society in 2020, utilized social media platforms like Twitter and Facebook to spread awareness about COVID-19, promoting best practices to curb its spread. In 2020, Facebook introduced a feature enabling Kenyan users to register as blood donors and receive notification about nearby donation requests, addressing a critical health need in the country. The Chiromo Mental Health Hospital established a digital relations department in 2018 to normalize mental health narratives, bridging the gap between mental health information and the community through social media. Moving on to legal cases, there's an ongoing lawsuit against Meta, Facebook's parent company, in Kenya. Content moderators have sued Meta for allegedly unlawfully redundancy, claiming union busting. In Ethiopia, internet social media usage remains relatively low, with only 24% of the population using the internet and about 5.1% on social media as of January 2022. Social media usage in healthcare is nascent but burgeoning. There is a noticeable campaign called Avoid Food That Is High in Salt, Mock Halibut, launched by the Ethiopian government to educate the public on the risk of high salt diet. In terms of legal cases, Meta is also facing a lawsuit in Ethiopia, although submitted to Kenya's High Court, for allegedly fueling ethnic violence through its algorithms. Amnesty International and human rights organizations allege that Meta's algorithm amplified hateful content, leading to a real-world violence. Claimants are seeking algorithmic change and a 1.6 billion victims fund. Social media in Eastern Africa is not just a tool for communication, it is increasingly becoming a catalyst for change in healthcare and a subject of legal scrutiny.
Moving on to Western Africa, before I dive into the specific country that I focused on, I wanted to give some of my overall findings and standout themes for the region as a whole. The population demographics in this region and throughout the continent should be a waving flag to the rest of the world that young people in Africa today are ambitious, creating and actively creating a better future. This can be the way we can see public health in this region and the future of it. The rapid growth of technology in the region is commonly regarded as good and set the region and the continent on track to be, quote, on par with the rest of the world. However, many move forward with caution as well. While reaping the benefits this technology brings, they must be mindful of the security, privacy, and social issues that come along with this technology. It is possible that they are learning from our mistakes and move forward with less trust in social media and the content they consume from social media in comparison to other portions of the world. And it is also noted that they are on the verge of a technology revolution and has seen a lot of radical social and cultural change. For social media use in Guinea, about 83% of social media users use Facebook. Now, this is very interesting because in comparison to all other social media platforms, none of these surpass even 10%. And I have a graph on the next slide that offers a really great visualization of the dramatic statistics here. And in 2023, there were nearly 5 million people on the internet. So think about that. 83% of that number is on Facebook in Guinea. And like I mentioned, you can see how this almost looks comical of a graph. The top line here represents the population on Facebook, and the bottom lines portrayed at the bottom are all other social media platforms like Instagram, Twitter, things like that. And what's really interesting I found in my research was that this population in Guinea and throughout Western Africa, there is a real distrust in what they read in the news, in the press, in social media, from outside sources. This stems from their long historic relationship with foreign powers coming in and influencing the press in their country. So it is no surprise, really, when you do a deep dive into the history, that they trust the social media that is, centered around each other and engaging with each other, and not an outside source. One of the more popular and well-known public health-focused social media campaigns in Guinea is actually USAID. And you might be thinking to yourself, how is that a campaign in Guinea? But there's actually a huge movement that has started in the COVID-19 pandemic that is a lot of effort is going in to confront the AIDS and HIV crisis in Guinea. A lot of foreign outside support really doing what they can to get the proper resources to the population. And government regulations on social media in Guinea as well. This is obviously a very unfortunate yet common theme that the government tries to overstep and influence and restrict. There's heavy and invasive restrictions being implemented on social media use. A tweet from LetBlocks, which is a source that tries to scan for these injustices, confirmed that these metrics of social media platforms, including Facebook, WhatsApp, Instagrams, have been restricted in the favor and in the interest of the high-end politicians in the area.
To introduce the South African region, I chose to focus on two prominent countries within the region, Zimbabwe and South Africa. South Africa has a population of about 60 million people, 80% of which are Christian, and a diverse array of languages, with 11 official languages. Most South Africans are able to speak at least 2 or more languages. Its history is characterized by British rule, apartheid, and social inequality turned to struggle and reconciliation. Zimbabwe, on the other hand, has a much smaller population of about 14.5 million people, with about 70% being Christian Protestant, and it has 3 official languages, Shona, Ndebele, and English, and 13 minority languages. Zimbabwe also faced colonialization and the struggle for independence throughout its history, along with economic decline and human rights abuses later on. South Africa's healthcare system offers free public care, usually in lower quality, and private options. Healthcare accessibility in rural areas remains an issue. Mental health access is also low, with only 27% of those in need of mental health services receiving them. Despite these problems, the country's healthcare is generally improving. Zimbabwe's public healthcare is subpar, and the facilities have limited capabilities. Emergency transportation to hospitals can be very limited as well. The fuel shortages have diminished emergency responses in capacity. Many medications are not available in Zimbabwe, and the provincial hospitals in rural areas are especially under-equipped. Social media use in South Africa. As of 2022, 41.19 million active internet users are in South Africa, 28 million of which are active on social media. WhatsApp is by far the most widely used social media platform. As of the end of 2021, 95% of internet users in the country use the messaging app. Facebook and Instagram followed with a penetration rate of around 87% and 73% respectively. The use of social media in rural areas in South Africa is growing, with the youth being the prominent users. Social media's impact on public health in South Africa. A study of South African youth in Cape Town found the indication of social media addiction among the young. Participants reported feelings of tension and anxiety when their digital devices are out of reach. There is a compulsive use of instant messaging applications, and the need to stay connected in the digital realm has stimulated the incidence of social media addiction. From 2015 to 2019, South Africa's health strategy from the National Department of Health acknowledged the role social media can play as a tool for public health promotion and education. Unfortunately, social media is omitted from the 2019 to 2024 National Digital Health Strategy for South Africa. Social media use in Zimbabwe. 5.74 million internet users in Zimbabwe at the start of 2023. Zimbabwe is home to 1.5 million social media users in January 2023, equating to 9.1% of the total population. 1.3 million of those users were subscribed to Facebook. Social media's impact on Zimbabwe. An Amnesty International study released in 2018 analyzed millions of abusive messages directed at women in over 150 countries. It was found that in Zimbabwe, those in public positions seem to bear the brunt of offensive sexist comments. People are often targeted on the platform Twitter due to their political affiliation, gender, or ethnicity. For the people of Zimbabwe, social media platforms play a critical role in healthy discussions about government and development, providing a space for users to engage with one another in a safe manner and even get in touch with elected representatives, and driving social change by shining a light on corruption and human rights violations. Social media governance by the Zimbabwean government. One of Zimbabwe's prominent journalists, Hopewell Chinoi, also known as Daddy Hope on Twitter, has used Twitter to expose corruption and engage citizens on public policy questions and promote civic education, especially registering to vote. This accomplishes engagement beyond what mainstream media such as radio, newspapers, and TV could have done. In December 2021, Zimbabwe introduced the new Cyber and Data Protections Act, which has been used to intimidate and harass journalists for doing their work and threatens to curtail media freedoms further.
As we begin our final discussion on our findings throughout this project, we would first like to note some key differences that we found between regions, or particularly noteworthy aspects that came up in our research of our selected countries. In the northern region of Africa, and particularly in Egypt, the large gender gap in social media was of note. This could be attributed to society and Islamic culture, which is typically male-dominant. Similarly, persecution of female social media influencers for quote-unquote immodest posts online was unique to this region. East Africa highlighted the various levels of social media usage between countries due to government limitations, as we saw in Ethiopia. In West Africa, and particularly in Guinea, we noted the near absence of all other social media platforms apart from Facebook, whereas other regions had a more even distribution of social media platform use. When comparing South Africa and Zimbabwe and Southern Africa, it was apparent that some countries have a stronger freedom of speech and expression than others, as some governments, like that of Zimbabwe, look to control the narrative of what their citizens are exposed to online.
Trends within the African continent: the young population, use of social media for social change and revolution, government intervention with internet shutdowns, adept at technology adaptation, and Facebook is the leading social media platform.
Policy recommendations for governments. When you look at the question, is governance of social media necessary? To an extent, it is. Some policy recommendations we can give to the government of these countries are to create a government agency to monitor trends and viral activities that could physically or mentally harm the public. Another suggestion would be content moderating. This would require a collaboration between social media companies and governments to create a safe space for users. And lastly, government promotion of accessible healthcare through all social media platforms to make the accessibility for healthcare easier for everyone and to make all that information available to the general public.
We also have a few general recommendations for social media companies. We recommend that they partner with governments to help monitor dangerous activity online in order for governments and social media companies alike to be able to protect their citizens and their users. We are also for banning hate speech across all platforms and having an agency internal to the social media company that would monitor negative trends and viral activities that promote these agendas. Many social media companies already have a version of this, but we would like to see this strengthened and have more of a focus on issues such as terroristic speech and things like that. We would also recommend creating guidelines that protect users without limiting their freedoms. So while online activity should be monitored, people should still have the freedom of speech and expression on online platforms.
Looking ahead to the future, we must ask ourselves about the future of AI. We've seen the impact of social media. We must take these lessons and prepare for the next technology revolution. Social media was let loose into the world, no restrictions, and yet we see two outcomes of not enough restrictions, there where human nature takes over and it becomes a bad thing, and maybe too many where the government oversteps onto the people. So how do we take these lessons and apply them to the next generation, the next technology revolution? And we've seen a lot of different statistics from all over the country of Africa today when it comes to the question of social media and its influence on public health. And I think some of the biggest takeaways is that maybe it wasn't all necessarily bad, which is what I think a lot of people would have assumed when they think about social media. They assume the negative impacts. And yes, those have been demonstrated as well. But we also have to remember that it can be a tool, but we need to find the balance of restriction versus regulation.